Why are so many people in therapy today compared to older generations like boomers or Gen X? And why when millennials and Gen Z try to express their feelings, are they so often called whiny, weak crybabies, snowflakes? They're told to get over it, stop blaming your parents, and take responsibility for your life. First, decades ago, there used to be a strong culture of keeping emotions to yourself, which was socially rewarded. Suck it up was a survival strategy for the majority of people. So today, when people talk about trauma, mental health, or how their childhood shaped them, older generations often interpret these expressions as weakness rather than as an opportunity to heal. And many boomers and Gen X experience this as betrayal, not progress. Second, defensiveness is easier than accountability. Admitting we were also harmed and we possibly hurt our children but called it love is psychologically very expensive for these generations. It threatens their identity as good parents who did their best and put food on the table, and opens up a hole in the soul, the fact that they were also often emotionally neglected and suppressed by their own parents, and they had to follow societal expectations just to fit in, not to be an outcast and not to embarrass anyone. Realizing this requires enormous healing that would take the rest of their lives, which feels overwhelming, I get it, especially when you were never taught how to process your feelings. Another thing, I'm not saying that no one had loving parents. Many millennials had wonderful parents, but at the same time, many didn't and were subjected to abuse that was normalized, including myself. The fact that the millennial generation is the first to go into therapy is not proof of fragility. It is proof that suppression doesn't heal anything. No one is waiting for a magic trick to undo past pain. All we want is awareness and an honest conversation. In fact, we probably understand better than anyone that older generations had no vocabulary for emotions, no safe space to talk, no access to therapy, and a culture that told them to just push through. And most of them did the best they could with the tools and skills they had. But doing your best in an injured state can still leave cracks in the next generation. Naming those cracks and what can be improved is not an attack. It's simply acknowledging what gets passed on when pain goes untreated, unseen. People today are in therapy not because they hate their parents or because they are too sensitive, weak, and pathetic. They're in therapy because they don't want to repeat the same unconscious patterns. That's the difference. No one is right or wrong here. It's simply a process that unfolds across generations.